This video is going to tell you what to do after your liposuction, how to put on all these dressings. Sometimes it seems really complicated. We want to make it super easy for you. Really, there's three parts to everything. One is going to be some sort of absorbent pad. You've heard us talking about Chuck's pad, a puppy pad. It could be a towel. It doesn't matter. Just something to absorb some fluid that we know is going to leak out. So let's say you had a tummy tuck and you had some tummy tuck, or we did some liposuction on the front. There's going to be a little incision, usually in the belly button, a couple in the groin, sometimes in the breast fold. They could be anywhere. It depends on every patient. But those areas are going to leak. So we want an absorbent pad on there first. And then the next step, what we're going to do is some sort of foam. Now you may or may not have foam depending on where we did liposuction. We use a very kind of contoured little, it's kind of like a Tempur-Pedic mattress. It's really nice. Helps give gentle compression around an area. So often if your loved one can help you, we'd put that foam that would then come around. Let's say you had liposuction on your back and flanks. And then we put a post-operative binder is going to go on next. And you want your binder to be snug, but not too tight that you can't breathe. Again, our whole goal after liposuction is to put some compression to these areas, help them heal down, minimize the amount of fluid that wants to build up, minimize the amount of swelling you're going to have. It just speeds up your recovery. So again, absorbent pad first, and then we have some foam on, and then that binder. Now after 2 to 3 days, a lot of that leaking is going to stop. Once that leaking stops, you don't need that absorbent pad on you anymore or a towel underneath. You can just do the foam and the binder. Sometimes, depending on the body area, you won't have foam and a binder. You may have a garment. Okay, this is going to be these post-op compressive garments. Think of something like Spanx. We'll give you your first set to you. That's part of your procedure. Sometimes patients want to get some more. That's great. We keep some extra ones in the office that you can purchase. We also have it on our website. Go to Forums and More, and you can order garments directly from our supplier, get shipped to your house. They have a tag. The thing to know about these is the tag's on the outside, totally different from your normal clothes. Tag goes on the outside, the seams go on the outside. We don't want these things rubbing up against your body. So that's just different from putting on your normal garment. But these are tight, they're snug. You would come into these garments first, and then you would put your foam on, and then you would put your binder on if that's applicable. Sometimes it's just the garment, sometimes it's just the binder, but just to give you a little heads up.